Let me guess, you are here to learn some engaging tactics for your CNA students. Well, you are in the right place. I'm Victoria Randall, a CNA instructor and a curriculum development specialist. I want to share with you some awesome learning styles that you can use with your students. Learning styles and learning theories are important to consider when teaching adult learners. Now, before we dig into these types, let us identify what this concept even is. Adult learners with previous experience or have knowledge, they learn differently. It can really shape the way they interpret information, the way you give it to them, or how they even go down memory lane while you're teaching. Let's face it, adult learners have a lot going on and they have a lot to manage. The adult has to remember to pay their rent, pick their kids up from school by 4 p.m., to go get milk on the way home, and even take out the trash and put it on the curb before the morning. It can be difficult to mix the idea of learning with all these different thoughts going on in the adult learner's head. Let's be honest, you have already wandered off mentally at least once already during this video. So adult learners, they need to be more outcome focused. They're not learning because they have to be forced to learn. They're learning because it's a choice that they've made. And typically they are looking for some type of outcome that they want to achieve. So this creates a learner who is ready to get to the point and to immediately apply what they have learned. Now that we have identified what affects the adult learner, now let's explore the different types of concepts or learning styles that will help them overcome and retain the information that you are trying to teach them. So let's explore the VAC model. There are quite a few adult learning models, but today I want us to focus on the VAC model. Now remember, adults typically like one of these styles over the other, but sometimes they can benefit from all of these styles, or some people learn in all these ways at one time. First, you have the visual learner. This is the learner who likes to read and they like to see. So think of pictures or whiteboards, diagrams, videos, all those types of things. These students also do very well with storytelling because they're able to visualize the story as you tell it. These students typically do well when writing notes or having workbook assignments or even creating those beautiful mind maps. When teaching adult CNAs who are visual, you could have them construct maybe a diagram that explains isolation precautions, or show them a video of someone washing their hands the proper way. See here my example on how you can use August Learning Solutions resources to do so.
In the August Learning Solutions Instructors portal, you can look up classroom resources like this. This is our Get Up and Think exercise. With this exercise, you can actually read a case study to the students and then consider different learning styles when implementing that case study. So let's read through this. You are caring for Liam. He's a 35-year-old man who's diabetic. He was in the hospital for pneumonia, but then acquired an MRSA infection on an open sore on his toe. The sore will not heal. He has had to undergo painful treatments to get rid of the dead tissue in the sore. He has now been in the hospital for 12 days. He is in pain and he is angry. He tells staff that it is their fault that he has this MRSA infection. Now, when I'm thinking about the visual learner, down here on D, it says, is it the staff's fault he acquired this infection? Why or why not? Now, what I could do as an instructor is actually take students to the lab, and I can engage in practices with the mannequin that I know would cause cross-contamination or infection. As an example for the visual learner, to see how this patient may have acquired an MRSA infection. As you see here, it says the client may have become infected due to poor hand hygiene by the staff, contamination of the room from a former client who had MRSA, or the staff not following appropriate isolation measures. So I, as the instructor, may come in inappropriately clothed for isolation measures, or I may have engaged in some type of cross-contamination when caring for the patient, or I could even show myself not cleaning the room properly between patients so that the visual student can get an understanding of how cross-contamination or this infection could have occurred.
Next, you have the auditory learner. This type of learner really likes to listen and they like to speak. So think of sounds or music or recordings or discussions. These type of students do really well with mnemonics. It helps them remember concepts or even songs that they can sing to help them relate the information they're learning to the topic at hand. So when teaching adults who are CNAs, who are auditory learners, you could have them create or present their own mnemonic that they have created for a skill, or maybe have them present a case study about abnormal vital signs, and then have them discuss what they would do in that particular situation. Here's an example on how you can use August Learning Solutions resources to help you achieve just that.
In our classroom resources, you can scroll down and you'll find an exercise called Putting It All Together. In this exercise, we are asking the students to name the 6 links in the chain of infection and an example of how to break each link. Now, this is a great exercise for the auditory learner because we can actually show our students these examples, and then the students can A, create their own mnemonic, or B, we can have a discussion, an open discussion, classroom discussion about infectious agents, reservoirs, portal of exit, and etc. Again, this helps the student retain the information by having the discussion or asking them to create a mnemonic.
Next is the kinesthetic learner. This is the type of learner that likes to touch and like to do. Think of role-playing or hands-on experiences such as having students lead activities. These students typically do well with engaging skills or demonstrations or even real-life calculation assignments. So see an example of August Learning Solutions resources and how you can use it for the kinesthetic learner.
Classroom resources, down at the bottom, you'll see an activity named Classroom Activities. This gives the instructor different ideas on different types of activities that can be conducted in the classroom or the lab. See here point number 2 where it says, students' demonstrations of the correct donning and removal of PPE when caring for a client on contact precautions for MRSA or C. difficile, as well as drop it or airborne precautions. So this is actually a great opportunity to take your kinesthetic learner and give them the ability to actually implement everything that they've learned. Because remember, your kinesthetic learner needs hands-on help or assistance in learning. So you can take your student, maybe put up on the lab room a sign that says MRSA contact precautions or C. difficile precautions, droplet, and etc., and then have all types of gowns, gloves, and masks out and allow the student to choose the PPE properly based upon the type of precaution for the room. Great exercise.
When teaching adult CNAs who are kinesthetic learners, you could have them do things like obtain a height in inches on a bedbound resident, and then ask them to calculate it to centimeters. Both tasks are tactile tasks. I want to know, in what ways have you utilized the VAC model in the classroom? Comment below and share with us some of your tactics so we can all learn. Are you ready to gain access to all of the resources that August Learning Solutions provides through your CNA textbook? Reach out to our team via email or by phone. We're happy to help you to make sure that teaching is a breeze. And by the way, be sure to subscribe to our YouTube channel for more informational videos just like this. Thinking about adopting our book or need access to our free instructor resources? Contact our sales team or email us. We look forward to speaking with you.